What if the very medical system designed to protect you in your golden years was, in some cases, causing more harm than good? What if I told you there's a quiet consensus growing among top medical experts, a kind of insider secret that the relentless more is better approach to medical testing after age 70 is leading to a silent epidemic of anxiety, painful procedures, and life-altering complications? All for problems that were never going to hurt you in the first place. It's a truth that challenges everything we've been taught about preventative health, and it leads to a baffling paradox, a mystery we're going to solve together today. Why did one of the most widely promoted men's health tests, a test pushed for decades as a lifesaver, become something that official guidelines now strongly recommend against for men over 70? The answer reveals a shocking truth about how our medical system operates, and it could save you from years of unnecessary fear and suffering. The difference between knowing this information and not knowing it is the difference between being a passive patient on a conveyor belt of automatic procedures and becoming the empowered CEO of your own health, protecting not just your lifespan, but your quality of life. In fact, a groundbreaking study from Yale University revealed that for women over 85, more than half, a staggering 54%, of breast cancers found through screening were likely overdiagnosed, meaning they were cancers that never would have caused a problem in their lifetime. The journey to understanding starts now. Welcome. I am so glad you're here. We are a community dedicated to navigating our health with wisdom and confidence, not just fear. Today, we're talking about a topic that's incredibly important but rarely discussed: graduating from tests you no longer need. Before we dive in, please remember that the information in this video is for educational purposes only and is not a substitute for professional medical advice from your own doctor. The goal here is to empower you to have better, more informed conversations with your healthcare team. We're going to count down the 5 medical tests that you and your doctor should seriously reevaluate after age 70. This isn't about neglecting your health. It's about upgrading it. It's a journey from automatic screening to intelligent, personalized care. And stick with me to the end, because we will solve that mystery about the men's health test I mentioned. And the answer will change how you view medical testing forever. Let's begin our countdown with number 5, routine pap smears. For decades, the pap smear has been a non-negotiable part of a woman's annual health routine. We can all relate to that feeling of slight dread, the cold speculum, the awkwardness of the whole procedure. It's a test we've been taught is a lifelong responsibility. But what if, for many women, that responsibility has an expiration date? What if you've already done the work and you've earned the right to graduate? The science here is actually quite simple and reassuring. Nearly all cervical cancer, we're talking 99.9%, is caused by the human papillomavirus, or HPV. HPV is a sexually transmitted virus. The logic follows that if a woman is over the age of 65, has had a long history of normal negative pap tests, and is either in a long-term monogamous relationship or is no longer sexually active, her risk of acquiring a new cancer-causing HPV infection is exceedingly low. This isn't just a theory, it's reflected in the official guidelines. Both the American Cancer Society and the U.S. Preventive Services Task Force, or USPSTF, state that women over 65 can stop cervical cancer screening if they have had adequate prior screening with normal results. Now, you might hear the statistic that more than 20% of cervical cancers are found in women over 65, which sounds scary. But here is the crucial detail they often leave out. These cancers rarely, and I mean rarely, occur in women who have been getting regular tests before they turn 65. The system has already done its job for you. So the solution here is not to just stop on your own. It's to become an investigator of your own health history. The actionable step is to talk to your doctor and confirm your screening record. Ask the question, based on my history of normal pap tests, do I meet the criteria to safely stop screening? For many, the answer will be a resounding yes. This brings us to a powerful myth buster. The myth is that your risk for cervical cancer stays the same your entire life. The shocking truth is that for most women who've been diligent with their health, the risk drops so low that continuing the test can lead to more unnecessary procedures from false positives than actual benefit. You've earned the peace of mind. It's time to claim it. Coming in at number 4 is a test that often leads to a diagnosis that sounds terrifying, but might not be what you think. The bone density scan, also known as the DEXA scan, and the osteopenia trap it can set. We all share a primal fear as we get older, the fear of a fall, the fear of that sudden, life-altering crack of a bone, a hip fracture that can steal our independence. So when a doctor looks at the results of a DEXA scan and says the word osteopenia, our hearts sink. It sounds like a disease. It sounds like your bones are on the verge of crumbling. But this is one of the most important distinctions we can make on our health journey. Osteopenia is not a disease. It is a risk factor. Think of it this way. Having osteopenia is like a building inspector telling you that the wood in your house is a bit damp. It's not rotten, it's not collapsing, but it's something to keep an eye on. It requires attention, but not panic. The reason this diagnosis is so common is because of how the test works. Your T-score, the main number from a DEXA scan, compares your bone density to that of a healthy 30-year-old. It is biologically normal and expected for your bone density to be lower than a 30-year-old's as you enter your 70s and beyond. The danger here is not the lower bone density itself, but the potential for overtreatment. A diagnosis of osteopenia can trigger an automatic prescription for powerful drugs like bisphosphonates. While these drugs are absolutely essential for people with severe osteoporosis, they are not without significant risks. Common side effects include severe heartburn and stomach upset, and in rare cases, they are linked to very serious complications, like osteonecrosis of the jaw, where the jawbone actually begins to die, and atypical fractures of the femur, the thigh bone. For a person with mild osteopenia and a low overall risk of fracture, the potential harms of the medication can actually outweigh the benefit of preventing a fracture that was unlikely to happen anyway. So what is the solution? It's to move beyond a single number on a test result and demand a more sophisticated conversation about your actual risk. Instead of just accepting a prescription, you can empower yourself by asking your doctor, "What is my FRAX score?" The FRAX tool is a calculator that estimates your 10-year probability of a fracture based on multiple factors, not just your T-score. This gives a much more accurate picture. You can also ask about the concept of a drug holiday, which is a planned break from these medications that many experts now recommend after several years of use to reduce the risk of long-term side effects. While Medicare often covers a DEXA scan every 2 years, the decision to test and especially to treat should be a deeply personal one, made with a full understanding of your true risk profile, not just a single, scary-sounding word. Our number 3 test to reevaluate is one that many people dread more than any other: the colonoscopy after age 75. Let's be honest with each other for a moment. If you've had a colonoscopy, you know the truth. The procedure itself, thanks to sedation, is often the easy part. The real trial, the true test of endurance, is the preparation. I've read countless stories from people in our community, and they all echo the same sentiment. That voluminous, foul-tasting liquid you have to choke down, the sleepless nights spent tethered to the bathroom, feeling utterly washed out and weak. It's a shared experience of visceral misery that creates a powerful bond. We do it because we're told it's one of the most important things we can do for our health. And for many years, it is. But as we cross the threshold into our late 70s and 80s, the math begins to change. The fundamental logic of screening is that you accept a small, immediate harm or inconvenience for a much larger, distant benefit. With colonoscopies for older adults, that scale begins to tip. The harms are immediate and become more significant with age. And the benefit, preventing a cancer that may take 10 or more years to become dangerous, diminishes as our life expectancy naturally shortens and the risk of dying from other competing causes increases. The proof is in the numbers. The risks of the procedure itself, while still low, begin to climb. A large meta-analysis showed that for patients over 80, the rate of adverse events is nearly 35 per 1,000 procedures. The risk of perforation, the most serious complication, is 30% higher for patients over 65 than for the general population. These are not huge numbers, but they are real risks that must be weighed against a shrinking potential benefit. This is why the most respected guideline bodies in the country have changed their advice. The U.S. Preventive Services Task Force and the American Cancer Society now recommend individualizing the screening decision for people aged 76 to 85 and stopping routine screening altogether after age 85. The solution, therefore, is to change the nature of the conversation with your doctor. It's no longer an automatic, "When is my next colonoscopy?" It becomes a thoughtful discussion. Given my personal health history and my age, does the benefit of another screening still outweigh the known risks of the procedure and the prep for me? That feeling of dreading the colonoscopy prep? Does that sound familiar? Let me know with a quick yes in the comments below. You are not alone in this, and your experience is valid. The shared experience of that dreaded prep is something so many of us can relate to. It's a reminder of the hurdles we overcome for our health. If you believe in the power of making these health decisions with wisdom and not just routine, take a second to hit that like button. It's a sign of support for everyone in this community who is on this journey to becoming their own best health advocate. Now for our number 2 spot, a test that is a cornerstone of women's health, but one whose balance of benefits and harms shifts dramatically as we age. The mammogram after age 74. There is a specific kind of anxiety that is unique to mammography. It's the anxiety of the callback. You've had your routine screening, you feel fine, and then the phone rings. A calm voice tells you they saw something, an abnormality, and you need to come back for more tests. The days and weeks that follow can be an emotional roller coaster. Sleepless nights, intrusive thoughts, a constant, gnawing worry that consumes your every waking moment. And for the vast majority of these callbacks, the end result is nothing. It was a false alarm, a benign cyst, a shadow on the image. The relief is immense, but the psychological toll is real and lasting. Studies have shown that the anxiety and distress from a false positive mammogram can persist for months, even years, after being told you are cancer-free. This psychological harm is not a small thing. It is a significant negative health outcome, and it's a harm that is directly linked to the even bigger issue with screening older women: overdiagnosis. Let me explain this crucial concept simply. As we age, our bodies are more likely to develop very slow-growing indolent cancers. These are technically cancers under a microscope, but they are so non-aggressive that they would never have grown, spread, or caused any symptoms or problems in your lifetime. Screening mammography, which has become incredibly sensitive, is very good at finding these biologically harmless cancers. But once they're found, the medical system is obligated to treat them, often with the same aggressive therapies, biopsies, surgery, radiation, used for dangerous cancers. This is overdiagnosis, and it's the ultimate harm, turning a healthy person into a cancer patient for a disease that was never going to hurt them. And the proof of this risk is staggering. This is the evidence bomb I mentioned at the start. A landmark 2023 study from Yale University researchers published in the prestigious Annals of Internal Medicine quantified this risk with shocking precision. The study estimated that for women aged 70 to 74, a staggering 31% of breast cancers detected through screening were likely overdiagnosed. This percentage climbs to 47% for women aged 75 to 84, and an astonishing 54% for women aged 85 and older. That means for women over 85, more than half of the cancers found by a mammogram were cancers that likely would have remained silent and harmless. This is why the U.S. Preventive Services Task Force, the leading panel of experts, has issued what's called an I statement for screening women over 74, which means they have concluded there is insufficient evidence to assess the balance of benefits and harms. This isn't medical neglect. It's a courageous and honest admission that the original randomized trials that proved mammograms save lives simply did not include women in this age group. The experts are acknowledging that the known harms of false alarms and overdiagnosis may very well outweigh the unproven benefits. Just imagine for a moment the peace of mind that comes from making this decision based on your personal health and your values, not just an automatic appointment card in the mail. Imagine feeling confident that you are choosing the path that best protects your quality of life. The solution is to have that deep, nuanced conversation with your doctor. To ask, given the high risk of overdiagnosis and the lack of trial evidence for my age group, what are the real, personalized benefits and harms of continuing mammograms for me? And now we arrive at number 1, the test that perfectly encapsulates the paradox of modern medicine and the answer to the mystery we started with. The number 1 medical test to reevaluate after age 70 is the PSA, or prostate-specific antigen test. To understand why, I want you to meet a man we'll call Robert. Robert was 72, healthy, and had been getting his PSA checked every year like clockwork. One year, his number came back high. The anxiety began immediately. His doctor sent in for a prostate biopsy, an invasive procedure where multiple needle cores are taken from the prostate. It was painful, and it was followed by bleeding and discomfort. The biopsy came back positive for cancer. Fear turned into a series of difficult decisions about treatment. He chose surgery. The surgery was a success in that the cancer was removed, but it left him with life-altering side effects. The constant, quiet humiliation of urinary incontinence, the loss of intimacy and connection from erectile dysfunction. Years later, his doctors told him that based on the characteristics of his tumor, it was likely a slow-growing type that probably would have never threatened his life. He had traded years of quality of life to treat a cancer that may never have harmed him. Robert's story is tragically common, and it is the heart of the PSA paradox. So let's solve the mystery. Why did this test, once hailed as a lifesaver, become something experts now warn against for men over 70? The answer is that the PSA test became widespread through brilliant marketing and public relations, not brilliant science. In the late 1980s and early 90s, the campaign for PSA testing borrowed the powerful "early detection saves lives" mantra directly from the breast cancer awareness movement. It was pushed on the public with enormous enthusiasm before a single high-quality randomized trial had proven that it actually reduced deaths from the disease. It was, as one medical journal put it, a sort of experiment on the male population, and the test itself is fundamentally flawed. A PSA test is not a cancer test. PSA is a protein made by the prostate, and its level in the blood can be elevated for many benign reasons. A simple prostate enlargement, which is common in older men, inflammation or infection, even recent sexual activity. This lack of specificity creates what doctors call a cascade of interventions. A high number triggers anxiety, which leads to a biopsy, which can lead to a diagnosis of a harmless cancer, which leads to treatments with devastating side effects. The test creates a self-reinforcing cycle of action that is incredibly difficult to stop, and the proof of the harm is now undeniable. The U.S. Preventive Services Task Force gives routine PSA screening for men aged 70 and older a D grade. That is not a neutral position. It means they actively recommend against it. Why? Because of the astronomical rate of overdiagnosis. Follow-up from the large clinical trials suggests that 20% to 50% of all men diagnosed with prostate cancer through screening are overdiagnosed. One model estimated that for a 75-year-old man, the overdiagnosis rate could be as high as 56%, and the harms of the resulting overtreatment are profound. After surgery, about 1 in 5 men suffer from long-term urinary incontinence, and about 2 out of 3 experience erectile dysfunction. The ultimate empowering solution for men over 70 is to understand that the expert consensus is clear. The potential for profound, life-altering harm from the cascade of PSA testing and treatment dramatically outweighs the uncertain benefit. You have the power and the evidence to arm yourself for a conversation with your doctor. Not to ask if you should get the test, but to state confidently, I understand the USPSTF recommends against this test for my age group, and I'd like to follow that guidance to protect my quality of life. This journey we've taken today isn't just about 5 individual tests. It's about a fundamental shift in how we approach our health in our later years. It's about moving from a passive, fear-based checklist to an active, wisdom-based partnership with our doctors. To make this practical, let's synthesize this into a few simple action plans or conversation starters you can take to your next appointment. First, the quality of life conversation. You can say, "Doctor, I'm over 75. For routine screenings like the colonoscopy and mammogram, can we have a serious discussion about the balance of harms versus benefits for me personally, given my current health and what I value most for my coming years?" Second, the graduation conversation. For a test like the Pap smear, you can ask, "Doctor, my records show I've had decades of normal tests. Based on the official guidelines, have I earned the right to graduate from this screening?" And third, the informed refusal conversation. For a test like the PSA, you can state, "Doctor, I've learned that the USPSTF recommends against PSA screening for men my age due to the high risk of overdiagnosis and overtreatment. I feel that protecting myself from those harms is my priority, and I'd like to follow that guidance." This isn't about being anti-doctor or anti-medicine. This is about being pro-you. It's about shifting from a mindset of more is always better to smarter is always better. You have the right to ask these questions. You have the right to protect your peace of mind and your quality of life. You are the CEO of your own health. And now I have a challenge for you. My challenge is this: pick one of these conversations you will commit to having at your next doctor's appointment. Post your commitment in the comments below. It could be as simple as, "I'm committing to the mammogram conversation," or "I'm committing to asking about my FRAX score." By making this public commitment, you are not only empowering yourself, but you are inspiring everyone else in this community. We are going to hold each other accountable and do this together. Thank you for investing this time in your health. Remember, you are your own best advocate. I'm here to support you on this journey. Until next time, stay wise and stay well.